The dorsal Lisfranc ligament, shown here in red, is able to be assessed by ultrasound, and it's just one of 3 ligaments that make up the Lisfranc ligament complex. We place the probe dorsally between the first and the second metatarsal. As we scoot up proximally, the first metatarsal base ends or disappears, and we cross the joint to the medial cuneiform. So that's medial cuneiform there. Whereas the second metatarsal to the left of screen has a slightly blunter appearance, and the probe is slightly oblique, so you'll see the lateral aspect of the probe pointing more distally. This is the dorsal Lisfranc ligament. When it's injured, it can obviously become thickened. There can be a higher fluid component, but the other thing we can notice is joint space widening. So you'll notice that the ligament's normally very, very thin, and the joint space is normally 1 millimetre, or roughly that. So if we have our patient erect and standing, they're able to then place weight onto the joint and take it off again. And we can assess the joint space widening or the diastasis, similar to a high ankle sprain. Instability may indicate that there's then damage of the interosseous component and the plantar component. Here's one that's slightly unstable. You can see joint space widening, even on the plain film on the left. And if we were to try and assess the plantar component, shown in purple, the probe is again slightly oblique, placed on cuneiform 1, and the ligament is very deep. You can see it's underneath the short axis of peroneus longus, outlined in red. So ultrasound's not ideal for assessment of the plantar aspect, but obviously very good at visualising the thin dorsal component of the Lisfranc ligament.